Hi, my name's Emily Wood. I'm the new Patient and Public Involvement Lead on the NCL Better Births programme. So I'm aware that I'm only starting and halfway through the programme, but we have 11 months left until December, so I'm very keen to get started so that we can engage with service users across North Central London and make sure that they're really well involved in not only the planning and the strategy for how we deliver services, but also to be able to support the evaluation of how that's working. So within the PPI strategy, I have four main aims. Initially, I really want to create a strong communications plan so that we can make sure that information is clearly disseminated out across to not only the public but also to the workforce so they know what it is we're doing at the moment. Secondly, I want to create an exemplary co-production strategy so that we're involving service users in a meaningful way throughout the entire programme. We obviously need to raise awareness about the Better Births programme overall and the future plans for maternity. One thing that I want to make sure that happens with the communications and the PPI strategies is that we're creating something that is sustainable so that we are upskilling the maternity voice partnerships that we have and supporting any new ones to grow and making sure that whatever we create now is something that continues an atmosphere and culture of co-production. Currently across North Central London, we only have two working maternity voice partnerships, one based at the Whittington and one which is the North Central London as a whole. We are looking, and I would hope within my role, to be supporting the new MVPs that they're trying to set up at Royal Free, Barnet, UCL and North Middlesex. But not having those groups poses an immediate challenge on how we're going to be reaching service users, and particularly making sure that we're reaching not just the usual people that are involved in participation, but those from the harder to reach communities. The Whittington have got some great connections already with Birth Companions and some other small organisations that are supporting more vulnerable groups, so we can definitely work on that. Now, hearing the quieter voices is a challenge in participation across all sectors, but it is something that we really need to make sure that we're doing within the Better Births programme. So creating a robust methodology and a systematic approach to this, I think, is really important so that we can include the emotive, we can include the stories, but that we're also making sure that we're engaging people in a meaningful way that really helps us to develop services and to look at how we're going to improve things for the future for women across North Central London and indeed nationally. So for the PPI strategy, I'm really excited to tell you about the methodology that I'm planning on using. We are going to be looking at using a participatory research method called participatory appraisal, in which we plan to train up a group of 10 to 15 recent service users. That could be any mums or dads that have used maternity services within the last 3 to 5 years. They will be part of a 2 to 3 month training programme where we will be supporting them to become community researchers. Effectively, that will mean that when we have a focus group or when we look to do participatory research events with the community, we're not asking small groups. We're not just getting a group of 10 women to find out what they think, but we're enabling those 10 women to go out and ask another 10, 20, 30 women. So we're getting hundreds of voices back and hundreds of service users' input into our strategy, making sure that the quieter voices, as I mentioned, are heard. So this team of 15 community researchers will have 3 days of training on participatory research methods. So that might include something like community mapping, for example, looking at how people access services, mapping out people's experiences from that first point when they get to the GP until they've gone through a whole array of maternity services and are seeing their health visitor with their new baby for the first time, and looking at what people's experiences along the way are and how that can feed into the Better Births programme, how that knowledge can support us in our service design. Another tool that we'll be training the team in is using, for example, maybe an appreciation line, so that we can look at what information women want to have and at what point in their journey do they want it, and which is the most important things for them to be hearing about. The team will then have 2 days in their local communities, so trying out these research methods with support from myself and a PA trainer. This is a great opportunity for us to be able to support the workstream leads to actually begin to ask the questions that they want to ask. So for example, what does informed choice mean to women? What does personalisation mean to them? Once the team have gone out and done their community research, they'll then be supported to come back and we'll teach them how to analyse that information. The information will be written up into a written report. Then the community research team will also be holding an event which we can share that information across all the stakeholders. So this is all stuff that will begin to happen in the first or over the next couple of months, and then will be something that can keep rolling on. So what I envisage is that the community research become a longer term resource tool for maternity voice partnerships as well as for local maternity services, so that when we need to start asking the community about what they want and what they need and breaking it down and getting them to be involved strategically in how we are going to design our services, we've got a team of people that can make sure that we're going out there and asking a much wider range of people. I would hope that at least one community researcher attends the Better Births operational meetings on a regular basis, so that we have a service user's voice there, but not just a service user that we ask, what do you think, but that we ask that service user, what are other people telling you? What do you know that other people think? So that by the end of the year, we've got not only a really robust strategy, but we have some excellent input and very good evidence of co-production over the year, but that we have the tools, the resources, and then we've upskilled the workforce and the MVP chairs to really be able to take that forward into next year. So I really look forward to hear what you think about all of this, and if you have any suggestions and ways we could continue to improve it.